Vitamin B12 is the nutrient that maintains the nervous system and the red blood cells. Additionally, vitamin B12 is vital for DNA creation. In short, vitamins B12 is the basis of all cell formation in the body. This video explores the dangers of vitamin B12 deficiency, avoiding it quickly, and the signs and symptoms to recognize it. Let us get into it. The average adult needs 2.4 micrograms of vitamin B12 a day. Vitamin B12 deficiency occurs when a person does not consume enough nutrients in their diet. Likewise, vitamin B12 deficiency could also be caused by the body's inability to absorb the nutrient effectively during digestion. The issue with absorbing is primarily common in older people. We are going to discuss the way to avoid vitamin B12 deficiency as an older adult with oral medication and injections. Please stay for that. There is evidence that some drugs can impair vitamin B12 absorption. Alcohol consumption, bacterial overgrowth in the body, and bariatric surgeries to remove stomach parts could all cause B12 deficiency. When a person consumes vitamin B12, it uses 2 steps to absorb it. First, the hydrochloric acid in the stomach separates the subnutrient from the protein it binds to. After, the intrinsic factor, another protein the stomach produces, combines with B12 and makes way for the intestines to absorb it. Even in the situation where the first 2 stages are complete, sometimes your intestine could struggle to absorb it, and that is the deficiency that we are discussing. So every step of the process should be functional to avoid these dangers we will share with you soon. Here are some B12 deficiency symptoms that you might recognize. The deficiency is often slow to develop. A combination of more than 2 of these symptoms is confirmation, although you still need a medical professional's diagnosis. Low levels of vitamin B12 deficiency can lead to fatigue, numbness and strange sensations, constipation, loss of appetite and weight, difficulty walking, depression, cognitive decline, sore mouth and tongue. We will discuss the treatment for vitamin B12 deficiency in a bit. There are ways to correct these symptoms, but first, let us look at some of the long-term effects of these symptoms and their deficiency. When vitamin B12 deficiency is left unattended for long, it can develop into neurological and anemic problems. There are some cardiovascular and nerve damage effects too. These are the severe dangers of a vitamin B12 deficiency. Let us talk about them briefly. Number 5. Anemia. As we discussed, the red blood cells need vitamin B12 to produce, and a lack of this essential nutrient can cause anemia. Megaloblastic anemia, where the red blood cells are immature and larger than usual, is an effect of B12 deficiency. This condition also affects the cell's ability to effectively deliver oxygen to the body. Some symptoms of anemia could include shortness of breath, pale skin, heart palpitations, tinnitus, and feeling faint. If you want deeper videos about health and diet, subscribe to this channel. We have a lot of it for you. Number 4. Dementia. Low levels of B12 destroy brain health. There is a sharp decline in children's schoolwork, memory loss, and irritability caused by high homocysteine levels. The higher a person's B12 levels, the lower their brain health problems. While old age comes with Alzheimer's disease, memory loss, and other brain health complications, there are not natural. Things like diet and nutrient deficiencies like B12 are the cause. Number 3. Neurological damage. The problems with numbness and tingling are all neurologically connected. Most people who suffer from B12 deficiency have poor balance and have no control in gait and other movements. It can also affect mental health and make a person depressed. Some damages to the spinal cord are caused by neurological damage due to B12 deficiency. Lastly, nerve damage is a severe effect of B12 deficiency. Number 2. Cardiovascular disease. Studies show that many people who have strokes and coronary heart diseases are B12 deficient. Some high homocysteine levels prove that there is a correlation between cardiovascular disease and B12 supplements. While there is no case to suggest B12 supplements as a cure or prevention for heart disease, there is a high chance that being B12 deficient could complicate treatment for heart disease. Number 1. Energy levels. People who have a deficiency are less likely to be energetic. They may experience balance problems and struggle with walking or any moderate activity. Constant fatigue and weakness can make the bones and body numb and irresponsive even when one receives boosts of vitamin B12 shots. The solution is to use supplements as soon as diagnosed with the deficiency to enhance athletic performance and general energy levels. Now we are going to discuss how to avoid B12 deficiency. The Institute of Medicine recommends that people over 50 and at a higher risk of vitamin B12 deficiency need to receive their daily nutrient ratio from a synthetic source. These sources could include a supplement or any products fortified with it. If you are a vegan who does not get enough B12 in the foods of choice, consider adding cereals and bread, which are higher in vitamin B12. Our next video talks about foods to avoid vitamin B12 deficiency. You can watch that for all the extra juice on avoiding B12 deficiency. Treatment for vitamin B12 deficiency depends heavily on the cause of the defect. The primary known options after diagnosis include oral medication, diet change, intramuscular injections. Unfortunately, some people with vitamin B12 deficiency end up needing regular injections for the rest of their lives. Please share some of the known dangers of vitamin B12 deficiency aside from the ones we have mentioned. If you know anyone who has suffered from this, you can share how their deficiency affected those around them.